why am I so dark? Ooh, why am I so dark? Is that better? That's better. Hello, my beautiful nurses. What is up? It's Justine again. Today I'm going to be sharing with you guys how I organize my work/clinical binder. Right now I'm using it for work, but I did use it back when I was in clinical last year. So let's get right on into it. So first of all, here's my work binder. I think I have shown this to you guys before. So this is my work binder. It's just a blue, I think a 1-inch binder, and you really don't need that much. Like, you don't need a big binder. The smaller is better because you don't want to have to carry something really, really heavy around. So on the front page, I have this little like memo sheet, I guess, that I made. And here I just have like my respiratory acidosis alkalosis. I have my insulins, my Chem 5, Chem 7, and Chem 10. I have my abdominal quadrants and all the organs that are in there. EKG interpretations, because as you guys know, I work on a cardiac unit. And here I have my common post-op complications. Now I literally copy-pasted pictures from Google, put it on a Word document, printed it, and that is it. You guys can make your own, personalize it however you want. That's the beauty of this. Next, on the back, I just have some like phone number extensions for the extensions in my hospital, because you're always on the phone when you're working, so definitely a necessity. And if we go back to the front, I always keep a little like a binder clip. Struggles of nails. So I always keep a binder clip up here, because what I will do is clip my patient information sheet on top of my binder. So when I'm taking report, I have a hard surface to write on, and wherever I go, my patient information is right here on top. Now, inside, ta-da! I keep a few dividers, and what I'll do is I will keep my patient's med sheets in here. So usually each separator is for a room. We have usually 1 or 2 patients per room. So I have 1, 2, 3, 4, 5, 6, 7, 8. That can accommodate up to 16 patients, which usually never happens. So I have these dividers. I used to have a clipboard, and I'd keep all my med sheets on the clipboard, but then you have like lab recs sheets and EKGs and all these different papers, and so I find it much simpler if each patient just has their own divider, because any sheets that I have that belongs to them, I just add it into the divider, and it keeps everything super organized and compact. Next, I also added a few tabs here to divide. I have like a bunch of papers, and I just added little tabs. So the first one is protocol, so all my hospital protocols. So this is a sepsis protocol, hypoglycemia, and I really keep these not to use them, but just like as a reminder if ever I'm just curious as to what's the hypoglycemia. I don't feel like going all the way into the like room where we keep all of these to look for it. I have it like right here. This one is IV heparin, Coumadin. Yeah, we don't actually use this. Damn, we should use this. This looks useful. Transfusions, level of care, pants log drip, and telemetry. You guys know I work on the telemetry unit, so we have to fax this down to the coronary care unit whenever we put a patient on tele. My next section is electrolytes. Now, these are sheets that I made when I was in school for my clinical, just to have like quick references. So here I have like sodium, potassium, magnesium, chloride, all. And then I have a table with my normal values for blood tests. So Chem 7, cardiac enzymes, coag, CBC, and then like however they write them out. Sometimes in the charts you'll see this. The doctors will write out their lab values, and you don't really know what they're referring to. So this is good to have just to know what they're referring to. Next, I have another section. I didn't put a tab, but it's all my medications. I also did this for clinical, and so I have color-coded the categories. So red is heart, blue is my rest, purple is my diuretics. I don't know if you guys can see that, but it's just all the most like common medications, the most important medications. Next, I have a huge section that once again I did for clinical last year, and these are all my diagnoses. We had to like research all the most common diagnoses on our floor and hand them in, but I just kept them in here because it's good as a quick reference to have if you have a patient with a diagnosis that you don't really know very well. I just have like a quick rundown. So heart failure, coronary artery disease, chronic kidney disease, and I put them on like plastic things so they wouldn't get ruined if I spill water, because I do spill water a lot on my binder. It happens at the med card all the time. Next, my last little divider is procedures. So if a patient is going for an angiography, what do I do before? What do I do after? They have a chest tube. What are the different chambers? I don't know. Let me look here. Wounds, different kinds of wounds, different phases of wound healings, things like that. And that is it for all that. I always keep some spare lined paper in case I have to take like notes on something, or if, I don't know, if ever you would need lined paper, well, there it is. And let's see, what do I have here? What is this? Blood specimen collection by order of draw. The order you're supposed to use, like when you take a blood test, the order, because there's a specific order for like the tubes, but I have this on my, next to my ID card. I showed it to you guys in my what's in my bag video, so I don't really use this. I have it on my ID card, but it's good to have if ever I lost that. And then in here, I got these papers when I was doing clinical a while ago. It's just like a little ruler, if you guys can see that, and it has just like literally a ruler, and it's just to measure wounds. So it's just like a bunch of papers, and you just rip one off, and you can take it and measure your wound, and then you can just throw it out. I have this little face scale. It's mostly for pediatrics. It's just like a face pain scale that we got in peds, and I've never, honestly, I've never used this, but I keep it in case I have a patient that cannot talk and can point, or a patient that doesn't understand, they're demented, I don't know. I feel like it would be useful for something. It was useful in peds though, but that was pretty much it. That is all that is in my work binder. If you guys do not like using binders, you can totally use a clipboard. I have done that in the past. In school, I also use clipboards. It's because you have less patience. You don't need to have all the dividers and that bulky stuff to carry around, but I really like having my binder. It's like personalized to me, and you can fix it however you want. You can add sticky notes. You can add literally anything you want. So I hope you guys enjoyed this video. Let me know if you guys make your own binder. You can tweet me a picture. I would love to see it. And I will talk to you guys in my next video. Bye, guys.